Hi, I'm Laura Peak, and it's my pleasure to welcome you to Standing Strong Nashville. As you can tell, I spent my $600 stimulus check on a fireplace. So cozy. When Planned Parenthood came to me and asked me to be a part of this event, I said, "What's the pants requirement?" And they said, "Excuse me?" And I said, "You must have misheard me. I'd love to be involved." So here I am, definitely wearing pants. Definitely wearing pants and ready to guide you through this special evening. 2020 was rough on all of us. When I was a kid, my mom used to say, if you feel sad, you should try faking a smile. Sometimes just the act of smiling can make you feel happier. So here goes nothing. Am I doing it? Is it happy? Okay, I could probably improve that a little bit. But we do have a lot to be happy for, right? The vaccine is coming. We've got a new administration. And in personal news, I've started wearing pants again. As a native of Nashville, Planned Parenthood of Tennessee means the world to me. A place where you can get safe, affordable, non-judgmental health care and crash a pedal tavern directly into the Grand Ole Opry. I mean, what a town. And we celebrate this on such a momentous occasion. Tomorrow marks the 48th anniversary of Randy Quaid. Oh, I'm sorry. I misread the teleprompter. Roe v. Wade. So sit back, relax, and enjoy a night of fun and giving for a great cause. Be sure to tag us in your social media posts with hashtag #StandingStrongNashville. And now we'll go to a message from CEO of Planned Parenthood of Tennessee and North Mississippi, Ashley Cofield.
Thank you for being with us tonight to celebrate Planned Parenthood of Tennessee and North Mississippi. This is such a momentous week. Yesterday, we welcomed a new administration in Washington, and tomorrow we'll celebrate the 48th anniversary of Roe v. Wade. While 2020 was a challenging year for all of us, and 2021 is proving to be no exception, our mission at Planned Parenthood is unwavering. We provide affordable, high-quality, and non-judgmental sexual health care, honest and accurate sexual health education, and fearless advocacy for your reproductive rights. The pandemic obviously has had a significant impact on our affiliate and our patients, as we've taken all the precautionary steps and made the investments necessary to keep our staff and patients safe. But we are proud to report that our 4 health centers, 1 in Knoxville, 1 in Nashville, and 2 in Memphis, have continued to serve every patient who needs us throughout this difficult time. On top of the pandemic, Governor Lee signed an omnibus abortion bill in 2020 that includes unconstitutional bans on abortion, as well as new medically unnecessary restrictions on abortion that have been very challenging for us to implement. Our commitment is to give as much access to abortion as we can until the day that we legally cannot. And our commitment to patients is that they will have a positive experience despite all the outrageous restrictions placed on us. To help our patients navigate the pandemic, we've launched expanded telehealth opportunities for our patients and expanded our free birth control and teen services statewide. And we're renovating and expanding our Knoxville Health Center to provide greater access to abortion services and comprehensive sex education. The thousands of patients we see each year are your neighbors, friends, and members of your families. I can tell you from dozens of conversations I've had with our patients how grateful they are that you're standing with them. You'll still find PPTNM educators and organizers all over our region, undeterred by the unexpected task of moving all in-person activities online. This team has also distributed nearly 800,000 condoms and other safer sex supplies and launched a new free condom distribution program in North Mississippi. And in 2021, we're growing, adding education and organizing staff in Chattanooga and North Mississippi as well. Last year, our advocacy team managed more than 300 volunteers who logged 3,000 volunteer hours. They hosted 3 days on the Hill at the Tennessee General Assembly, conducted advocacy workshops, and produced action forums for supporters to learn about legislative attacks and to develop grassroots lobbying skills. 2021 legislative sessions have already begun in Mississippi and Tennessee, and our team is gearing up to keep you informed and hold our elected officials accountable. Our 501c4 organization, Tennessee Advocates for Planned Parenthood, takes our activism a step further and does the lobbying, organizing, and electoral work necessary to protect our Planned Parenthood affiliate and our rights. This work is more necessary now than ever, We have to double down and change the extreme political forces in our state. I'm proud that our affiliate is leading the charge in Tennessee. Advocacy in the courts on behalf of our patients may be the biggest theme of 2020. The governor stopped us from providing access to surgical abortion services during the early days of the pandemic, and we had to file a lawsuit to restart these time-sensitive services. The omnibus abortion bill also forced us to take the state to court to fight this unconstitutional attack on our personal autonomy and access to health care. We're fighting that bill on multiple legal fronts, including a lawsuit to stop Tennessee from forcing our physicians to lie to our patients about medication abortion. Thanks to your support, we have been able to fight these legal battles during a pandemic while keeping our doors open for our patients and taking care of our hardworking, brave, and dedicated staff. We continue to witness the centuries overdue reckoning on racial justice in real time, affirming and strengthening our resolve to fight for equitable access to vital health care, no matter what. The white supremacists who violated the U.S. Capitol on January 6th include many of the same people who protest at our health centers. Their actions only serve to strengthen our resolve. Now more than ever, there's so much at stake: equality, life, health, dignity. I promise you that your Planned Parenthood affiliate will never give up, ever, on anything that could erode your rights or your access to health care. We will fight every battle, big and small, because in our book, every person counts. You, our donors and volunteers, are the heart and soul of Planned Parenthood, and we wouldn't be able to get through the tough times like these without you. Thank you for your unwavering support.
My name is Gail. I don't think that when people think of Planned Parenthood, they're thinking about someone like me, someone who is married, someone who is educated, someone who's already a parent and who planned their parenthood, but I still needed them. They still provided a service that was very much life-changing for me. I got a bilateral tubal ligation. The procedure went smoothly. In March was spring break, and I started experiencing pain in my pelvic region. As time went on though, those cramps became increasingly worse. The pain became so bad, I couldn't breastfeed my son. I was sleeping on the floor. I couldn't get my kids dressed. I could barely dress myself. I had to have assistance to bathe. My husband and I started having end-of-life conversations. I called my doctor and I said, hey, I'm about 4 or 5 weeks post-op. There is something wrong with me. Oh, we don't have anything for another 8 days. I was like, I'm telling you, there is something wrong. I'm not gonna make it 8 days. The next day, I go to urgent care. The doctor, who's a woman, comes in. She stands like 6 feet away from me. This is pre-COVID. So she was social distancing before social distancing. She doesn't touch me. She's like, I don't know what it could be. I don't know, just wait on your appointment. So I leave feeling very defeated. I called my mama and she was like, you know what? You always talking about Planned Parenthood, so just go up there. I go in and I was like, I need you to help me. You know, like in the movies where somebody's been like shot and they go to the ER and they're like, help. That's how I am at the desk, right? The person at the front desk was like, don't worry. Like that's literally all she said. It was, don't worry, we got you. So I fill out my paperwork and I go back. The doctor's like, I can't see what's wrong with you right now. But she says, you know what? I'm gonna send you somewhere. I'm gonna send you to get an ultrasound and we're gonna figure it out. I ended up having pelvic inflammatory disease. This pain that I was experiencing was just an infection that could have led to other serious things. Planned Parenthood, I think, made the difference in me going from thinking I had cancer, I had something where I was gonna have 6 weeks to live, to knowing that I had something that was manageable and wasn't gonna kill me, which only enraged me by the time I got back to my doctor's appointment. Planned Parenthood to me means people who meet you where you are. Planned Parenthood to me now is like a community caretaker. There's a difference between doing good and being good, and I think that Planned Parenthood empowers their medical professionals to be good people and do good things to good people.
Hi, we're Planned Parenthood of Tennessee and North Mississippi's Community Engagement Team. We work to protect and defend access to Planned Parenthood services and to Tennesseans' reproductive freedom. Every day, we put Care No Matter What into action.
Our team is on the ground helping ensure that all of our patients, volunteers, and supporters feel welcome in our health center and in this movement for reproductive rights.
We work with community partners to help break down silos because we know that reproductive health and rights do not exist in a vacuum. They're interwoven into every issue that affects our community, from voting access, workers' rights, LGBTQ rights, education. By working together, we can imagine a more equitable future for all.
Our Generation Action chapter at University of Tennessee at Knoxville has continued to meet virtually and is finding ways to keep students safe on campus even during a pandemic.
In this difficult time, PPTNM and RAIS continue to provide direct services to the Latinx community. Food bank, easy and condom distribution, 1,000 of masks and hand sanitizer, translation of information into Spanish and another dialect like Amman or Quiche, along with a coalition of more than 25 pro-immigrant and Latinx people organizations.
We believe Tennesseans' reproductive health and rights are worth fighting for. Together, we're a powerful voice. We can create a culture that values and upholds reproductive freedom by
decreasing abortion stigma in Chattanooga,
holding our legislators accountable in Middle Tennessee,
reclaiming the narrative about reproductive health while sharing our stories in Jackson,
knocking on doors to register voters in Rutherford County,
providing the Spanish language resources to and meeting the needs of Latinx communities in Memphis,
following the lead of Black-led organizations fighting for racial justice in Nashville,
escorting patients from the parking lot into the healthcare center and showing appreciation for the healthcare staff,
fighting every day at the State House so that Tennesseans have the freedom and opportunity to control their own lives.
Together, we fight for all.
The support of our volunteers makes it possible for us to meet the growing need for health services in our community. Last year, more than 300 volunteers contributed nearly 3,000 volunteer hours, supporting our health centers, special events, fundraising efforts, advocacy and community outreach, and education programs. We would like to take this time to recognize some of our outstanding volunteers in Middle Tennessee who provide exemplary service and support to the advancement of sexual and reproductive health and rights. The 2021 Health Educator of the Year Award is presented to Brianna Perry. Brianna is the co-executive director of Healthy and Free Tennessee, a statewide organization working to promote sexual and reproductive health and freedom. While an undergrad, Brianna developed a passion for Black feminism and community organizing, with a focus on Black women and reproductive freedom. Before obtaining her master's degree, she taught English, science, and social studies for 2 years in her hometown, Memphis. While teaching, she was also involved in organizing efforts around reproductive health, sexual assault awareness, and racial justice. Today, she organizes around Black feminism, reproductive freedom, abolition, and racial justice. The 2021 Volunteer of the Year Award is presented to Melissa Sauter. Melissa has served as a PPTNM volunteer leader during lobby days, participated in electoral phone banks and legislative actions, and assisted with tablings and data entry work. Melissa volunteers because she is a fierce believer in bodily autonomy and supports Planned Parenthood's mission to provide essential reproductive and educational services to those who need them.
Oh, I didn't see you there. Next up, I'd like to introduce Tennessee Advocates for Planned Parenthood Executive Director, Francie Hunt.
Happy New Year. Tennessee Advocates for Planned Parenthood spent most of 2020 fighting abortion bans and working around the clock on state races. And we elected 2 more reproductive health champions in the state legislature, all while working safely in the midst of a pandemic. 25 of the 34 candidates endorsed by Tennessee Advocates for Planned Parenthood won their elections. As we catapult into 2021, we are not going to let the violent insurrection by white supremacists in the U.S. Capitol deter us from protecting the health and rights of Tennesseans. Not surprisingly, many anti-abortion extremists were behind the siege in D.C. as well. We are entering this year ready to deepen our relationships and communities across Tennessee, build our advocacy base, and strengthen our cross-movement partnerships. We want to work more closely with you, our existing supporters, in all of those efforts. With the Tennessee General Assembly back in session, Tennessee Advocates for Planned Parenthood is continuing to speak up on behalf of the majority of Tennesseans who want abortion to remain safe and legal, who believe that reproductive and sexual health care is essential health care, regardless of what we look like or where we live. We cannot allow politicians to continue to use abortion as a wedge issue, a tool used to divide us so that we don't make the changes we really need. In the last election, we learned that change is possible. 2 years ago, Georgia passed one of the most restrictive abortion bans in the country, and now they're sending 2 senators to Washington as reproductive health champions. We can do this in Tennessee too, but it will take committed, sustained effort from all of us to make it happen. Tennessee Advocates for Planned Parenthood is committed to working alongside our partners and you, our supporters, to achieve the long-term change we need in order to keep abortion safe and legal. Thank you.
I'm Blythe Clippinger, and I'm a PG-13 player. I feel like hearing and learning about sex from peers definitely makes it more digestible information. It can be kind of daunting when you're hearing it from a parent or a teacher, especially with the culture of like kind of trying to scare teenagers out of having sex.
Turns out she was allergic to artificial banana flavoring and had an allergic reaction.
Were the condoms?
I've always been really into spreading awareness about sexual education, safe sex, reproductive rights, etc.
Since we are primarily a theatrical group, we inform peers in our community about sex ed through skits. At our meetings, we will discuss topics to talk about during our skits, such as healthy relationships, access to sex ed resources, basic anatomy, ways to talk about sex ed with others. I was so excited to become the resource for my peers, to just be a walking Google.
We also just make ourselves available about just anything related to Planned Parenthood.
If I wasn't in this program, I would want someone to be that person for me as well.
Scene 1, coffee shop. Bridget enters and walks up to the counter where Sam is standing.
A struggle with everything that's been going on with Corona.
COVID has definitely been an adjustment.
A big part of the players is the fact that they do in-person performances and in-person workshops. It's really hard to translate that to online.
It's forced me to go out of my comfort zone.
I have certain stories on social media because that is a big platform that we connect on, and they can ask anonymous questions. I also post those anonymous questions back onto the story so other peers can look into it.
They do all-day Zoom school, and then they are still willing to hop on a Zoom call with me for at least an hour. I think it speaks to how passionate they are about the things that we do.
I love all the people that I've met through PG-13 players. The PG-13 community is so strong that, we're able to bring this energy anywhere.
Yeah, I'm excited for the rest of the year with PG-13 players.
Next, we'll hear from Planned Parenthood of Tennessee and North Mississippi's Chief Medical Officer, Dr. Kimberly Looney.
We are extremely grateful to all of our donors and supporters because their generosity allows us to continue our mission, but not only that, it allows us to continue our mission without judgment. And that is extremely important to the people that we serve. I see it in all facets of what we do. I had a patient presenting for medication abortion, and it was her first day of counseling. And at the end of the counseling session, after I had concluded her counseling, the patient looked at me and she said, "Is that all?" And I said, "I don't understand. What do you mean, is that all?" And she said, "Well, I'm just waiting. I was waiting to be judged." I was in awe of that. I had to remind her, there's no judgment here. We support you in every facet, in any decision that you make. That is part of our job and what we do and how we service you. So anytime you walk through these doors, there will never be any judgment. That translates across the board for us. I have a patient coming for gender-affirming hormone therapy. The appreciation and relief in their eyes when they realize they have come to a clinical healthcare setting where they feel like they are not judged, they can be who they are and still get quality, affordable care. And it's a very important part of what I do. It's also important to understand that when patients come in to us, it is often a difficult decision that they trust us to help move them through because they feel judgment from so many other places. It is very common for me to see, for instance, a patient struggling with their faith about their healthcare decisions. And I take it as a privilege for me to be able to say, I see you, I'm here to help walk you through this process. I'm here to be a source of trust, but not a source of judgment. And for you to know that you can still make the proper health decisions and stand in your faith in the way that makes you feel you are whole. And now I want to cry.
Hi everyone.
Hi everyone.
I hope everyone is being safe out there.
We've been working hard to provide our patients with essential, time-sensitive healthcare services.
For the patients that need us most.
We've been doing a lot to keep our patients and our staff safe.
We're pre-screening and taking temperatures of patients and staff when they come in.
Finding ways to create social distancing.
Our colleagues in other departments have been helping out at our health centers.
We've added PP Direct, a phone app so patients can get prescriptions for birth and UTI treatments mailed right to their homes.
And we're adding some telehealth services so patients won't have to come in.
Our medical staff are traveling all across the state to different health centers
to make sure we never have to turn a single patient away.
This is what teen care looks like.
It's an uncertain time, but one thing we know for sure.
We are all in this together.
No matter where we are.
In the health centers.
At home.
In Knoxville.
In Memphis.
In Nashville.
Thanks to your support,
we'll continue to be here for our patients, our education clients, and our supporters.
They're our family, they're our friends, and they're our community. They need us. At Planned Parenthood, we care.
No matter what!
And
this is what care no matter what looks like.
Tonight we have seen some incredible testament to what makes Planned Parenthood, our patients and our supporters, such essential parts of our Nashville community and the entire Planned Parenthood affiliate region.
For 80 years, Planned Parenthood has been a place of care, information, healing, and health for tens of thousands of individuals.
Every day in our health centers, we see patients of all races, socioeconomic levels, and gender identities.
Who all need and deserve affordable, confidential, and non-judgmental care.
But our ability to serve our patients has been more necessary and under greater threat than ever before.
We can no longer count on the courts to be there to protect our rights in Tennessee and Mississippi.
Because of this, our resolve has grown stronger.
We're going to have to fight and advocate like never before.
The astounding progress that we've seen in Georgia proves to us that sustained grassroots activity works.
But it's going to take all of us working hard every day over the next 2, maybe even 4 or 6 years to get this done.
We will have to make more calls, knock on more doors, and raise our voices together.
We need to invest in educating the public so that we can hold elected officials accountable for the destructive policies that they enact to control our lives and to deny us health care. We will need you in the days and weeks ahead to fight with us.
Tonight, we need you to give.
Please take a moment to click the donate button on your screen or text SS-NASH21 to the number 91999 to make a gift now.
Please give generously.
This virtual event has been a wonderful celebration of our commitment to the diverse people and communities we serve.
But our current fights at the state and federal levels mean that we cannot rest.
Every day, we must recommit ourselves to caring for all of our neighbors, no matter what.
On behalf of the thousands of patients we serve each year, thank you.
Thank you.
Tonight we have raised more than $40,000 for PPTNM, thanks to each of you, our generous sponsors and donors.
On the eve of the Roe v. Wade anniversary, we celebrate your dedication to creating a more just and equitable world. Thank you for joining us tonight, and thank you for always standing strong with Planned Parenthood. Good night.
Thank you for joining us tonight. In 2021, we'll keep fighting for the health and reproductive rights of all people, and we're happy to have you by our side. Follow Planned Parenthood of Tennessee and North Mississippi for updates, donate if you can, keep wearing your masks, and only put on pants if you feel like it. We love you. Good night.